Hi, I'm Krista, and I am a nurse and a patient advocate and a breast cancer survivor. My story really begins with my mom's cancer diagnosis. She was diagnosed at age 48 with stage 3 breast cancer. And at that time, she was only tested for 2 gene mutations linked to breast cancer, which were the BRCA1 and BRCA2 mutations, and she was negative. So fast forward, she did every type of treatment, chemo, radiation, hormone therapy, everything. She put up a strong fight for about 12 years. And shortly before she passed away, she was fortunately offered expanded genetic testing for other genes linked to breast cancer. She did test positive for a mutation in her ATM gene, which was a pathogenic mutation and higher risk than the average ATM gene. So she shared that with all of her children because we then had a 50% chance of inheriting that from her. And so that we had the option to also test for that mutation. A few months after she passed away, I decided to move forward with my own genetic testing and found out I was also a carrier of the same mutation. So I had a 69% risk of breast cancer and a 5 to 10% risk of pancreatic cancer, and then also a 2 to 3% risk of ovarian cancer. Because I was at high risk for these cancers, I then started to follow the recommendations for more thorough and frequent screenings, which meant on top of mammograms, I was also doing breast MRIs, so alternating every 6 months. So I started that process and also started considering different surgical options for preventative surgeries. So during this time, my mammogram was normal, but my breast MRI did show an abnormality. So we did some follow-up testing, ultrasound, diagnostic mammogram. At that time, they said that it did not look like cancer. I was nervous about that with my risk, so I followed up and had 3 specialists actually tell me that it was not cancer, take my time, make my decisions, and kind of move forward with that surgical plan that I had in place. So I did that. And because it started to have a possibility of affecting the process of my surgery, I did request a biopsy, and it came back. And 2 weeks before my preventative surgery, it showed a diagnosis of breast cancer. It was a little bit of a shock. I went into my biopsy thinking, oh, I'm good. This is just kind of like a routine. Like, let's make sure it's okay to move forward with my surgery in this order that we had planned. And so I was actually really surprised at the diagnosis, but I was grateful to have that plan in place already and that I wasn't scrambling to make decisions, and had my first surgery, double mastectomy with deep flap reconstruction, January 30th of this year, followed by a second surgery in April. So luckily, and I really believe that I owe this all to my mom and advances in genetics. And I'm grateful every day for the fact that she did genetic testing, because to this day, like at this point in time, I don't think I would still have a diagnosis based on like my screening schedule. And so I'm very grateful. I was able to avoid chemotherapy and a lot of the other things that I watched her go through. And so I'm grateful for that every day. It saved my life. If you're interested in doing genetic testing, the first step would be to talk to your medical provider. And this sometimes can be your primary care provider, an OBGYN, or any specialist in the field of cancer that you may or may not have a family history with. And you're going to want to request a hereditary cancer panel. And that screens for somewhere around 79 different genes now that are linked to cancer. And so the first step would be to request that from your provider. And most of the time, they'll recommend that you see a genetic counselor, which is a great idea, in my opinion. They're amazing, and they have the most up-to-date information on the different genes and the risks associated with each. And they do a deep dive into your family history and then make recommendations for different testing from that point. It has really changed my life. I have 3 little girls, and I just think how different it's going to be for them, and how much they can avoid. When it comes down to choices for reconstruction, there are typically 3 main choices that are offered to patients, or should be offered to patients. And one of them is aesthetic flat closure. The second one is breast implants. And the third is flat-based reconstruction. So flat-based reconstruction is one that's a little less known. It was my choice. And it is, rather than having an implant, they take tissue from a part of your body and basically transplant it with all of the vessels and use that in place of that implant for your reconstruction. It's pretty amazing the way that they do it. And there are different places that they can take the tissue from. One of the most common is the one that I chose. It's called deep flap reconstruction, DIEP. And they take tissue from your abdomen and use that as, or for the reconstruction. So it's a little bit of a longer surgery up front. It was a 2-phase surgery for me, and that's very common for patients who choose this reconstruction option. It is around an 8-hour surgery usually, so a little longer. My advice to anyone who is facing these choices, they're hard choices, right? They're life-changing decisions that you have to make, and sometimes the choices, you aren't given a lot of time. But the thing that I hope that everybody understands is that there are different options out there, and regardless of what anyone else thinks, whether it's your provider or your family members or someone who has been through it, and ultimately it's your decision and it's what you have to live with, and it should be the choice that makes you feel the most at peace moving forward. I have a lot of patients who I talk to who do get very frustrated because they were not offered all the options. And so that's one of the reasons I like to share my story, because even for me as a nurse in the beginning, I did not have a clue that this was an option. I guess my biggest advice would be take your time. Even with a cancer diagnosis, you have time to make an informed decision. Consider all of your options and choose the one that makes you feel the most at peace moving forward. The recommendation for me treatment-wise moving forward, I had a very low risk of recurrence. My Oncotype score was 1 out of 100. So no chemo was recommended, but I was hormone receptor positive, HER2 negative. So the recommendation for me was tamoxifen, and that would be over a 5-year period. So I am at this point only 3 months in, but very happy to say that my side effects have been very minimum so far. I know that can change, but so far, not bad. Just a little bit of sleep disturbance and fatigue, but nothing that is not manageable. One of the things that my oncologist, who I love, recommended was making sure you exercise every day, and that was going to make the biggest difference in my side effects on that medication. So he said, don't stop. So I increased it. And so I'm going to keep doing that and hope for the best moving forward. I know that can be really hard side effects sometimes. And it's always a really hard choice. It was something that I never wanted to do, which is why I chose the preventative surgery. But here we are, just try to make the best of it and, take it day by day. I think I tend to carry stress well. somehow. But after everything was finished, I felt this huge weight lifted off my shoulders. And I remember saying to my husband, like, I didn't even realize how much I was carrying until I was done with the surgery part. It's a huge stressor, but I did try to do a few things during the last year or so as I was going through all of this that helped a lot. Um, for me, I'm not necessarily like a meditation person, but that is very helpful for a lot of people. For me, I have a swing on my back porch, and that's kind of my space where I spend a lot of time. And I guess it could be similar to meditation, but that was very helpful to me. I would just go out and just have quiet, turn off the phone, have time to just kind of process things and swing on my swing. But grounding is also really good. Having somebody to talk to. I'm very lucky. My husband is very supportive and he listened to me. I'm an out loud processor. So he listened as I made all these hard decisions and changed my mind 500 times, and just the back and forth and talking about all the things that I'm learning about food. And, you have to have a person who is willing to listen and not necessarily give advice. So that was very helpful. I'm also, back to the exercise, but running is a huge stress relief for me. So that was one of the things that I also tried to focus on, was making sure I was getting running in and some deep breathing. One of the biggest things that feels overwhelming to a lot of people who have just been diagnosed with cancer or are at high risk is, what do I eat, right? That was one of the first things that I said to my doctor. What do I eat? Is there a specific diet that I should be on? I mean, I talk to women every day who are asking the same questions, and it is one of the most impactful things that we can do, but also one of the most overwhelming, especially if you're trying to navigate all of these things that are being thrown at you with new diagnosis and high-risk genes. So, I am in a master's of medical nutrition program right now, which I love, and I get to focus a lot on the research with cancer prevention and all of the new studies that are coming out, and I love it. I'm very passionate about it. But I will also say that there is no perfect plan. There's no perfect diet that we can all do to prevent cancer, right? There's no 100% guarantee with anything when it comes to cancer. It does what it wants, but some of the best recommendations I can give are to eat a lot of plants. So one of the best things you can do is eat lots of fruits and vegetables. I think the recommendation is 5 or 6. I try to go for 8 to 10 every day, which sounds like a lot, but once you start incorporating them and finding different ways to do it, there are so many things in fruits, vegetables, nuts, legumes, whole grains even have so many benefits for cancer and trying to prevent cancer and reduce your risk as much as possible. The reason that I like to share this kind of information is because for me personally, moving from this place of overwhelm and trying to navigate everything into a space where I felt more empowered was huge for me. And I remember thinking, I'm a nurse, and how much of this am I didn't know from the start, and how much have I had to learn? And I felt very fortunate to have access to a lot of courses and certifications that not everyone has. And like I said, I feel like I kind of owe my life to my mom and genetic testing, and I would be in a very different place without that. And after I went through all this, I felt this huge responsibility to share with others, because I know there are so many people who could benefit from this information. And even if it makes a difference for one person, or helps one person feel more empowered in their decision making and informed about the options that are available, and even the genetic testing, and if it helps one person or prevents one cancer diagnosis, it's totally worth it. No matter what phase you're going through, it's scary and it's overwhelming, and whether you have been diagnosed with cancer already or are a pre-fiver who is just starting out on your journey, just know that it's not always going to feel like it feels right now.